மேம், ஹேர் டிரான்ஸ்பிளான்ட் அப்புறமா என்னோட டெய்லி ஒர்க் ரொட்டீன்ஸில் ஏதாவது ரெஸ்ட்ரிக்ஷன்ஸ் இருக்குமா?
Yes, restrictions are there. Initial stages la, like initial 1 month. Okay. So initial 15 days, yeah, it is a surgery. There are too many holes we put on the head to take the hair, to implant the hair. So infection chances are there. So we want you to keep the scalp clean. Why we tell you don't go in the sun, don't put helmet, because if you sweat a lot, okay, and that sweat sits over there, higher chances of bacterial contamination, higher chances of infection. So the restrictions are there only maximum up to a month. After that, if you are a person who wears helmet, if you are going for swimming, you want to use chlorine water, you want to play sports, do gym activities, you can do everything as normal. Once the transplant is complete, once the healing process is over, your hair behaves like a normal hair. Okay, so you can do all the activities how you were doing before, just after a period of 3 to 4 weeks, that is maximum a month.
மேம், அதே மாதிரி ஃபுட் டயட் பிளான் அப்படின்னு தனியாக இதுக்கு இருக்கா மேம்?
Good question, little different. Okay, I will explain you. For hair and skin, diet is very important. How it is important? Anything you eat, if you are not taking enough nutrition, if you are consuming too much of fizzy drinks, if you are having a lot of junk food, so the nutritional value of it, whatever you are eating, goes down. If you are not strong and healthy from inside, it will show on your skin, it will show on your hair. Okay, before a hair transplant or after hair transplant, it is same for everybody. If you want to keep your hair healthy, you have to make sure that you include green vegetables. You include seasonal fruits in your diet. Okay, one fistful of nuts in your diet. Okay, like 8 to 10 nuts, like healthy seeds like sunflower seeds and all the natural things. You don't have to go for hi-fi things to maintain your nutrition. Apo hair transplant, after the hair transplant also same thing applies. Apart from nutrition, your lifestyle habit, like how many hours you sleep, how is your quality of sleep, the stress level, they impact a lot on your skin, on your hair also. Okay, even if you are taking all the medication, your nutrition level is good and all everything, the stress hormone level will directly impact your hair, and it will impact your hair growth, your hair fall will be increased and all. So that is very important. See, when we sleep, our body regenerates, it repairs itself. Okay, sleep, melatonin is secreted, that helps in the hair cycle. So adequate amount of sleep, good hydration, good nutrition, normal nutrition, don't take too much of oily food, include whatever I told, protein. These are the things which are important even before or after hair transplant. There is no specific diet you have to change after hair transplant, but you have to be a healthy person with a moderately healthy lifestyle. That should be just enough.
மேம், இப்போது லாஸ்ட் டவுட் மேம், லாங் டேர்ம் டிசீஸ் இருக்கிறவங்களுக்கு, சில பேருக்கு பார்த்தீங்க அப்படின்னா டயபெட்டிஸ் இருக்கும், பிபி இருக்கும், அப்படி இருக்கிறவங்களும் ஹேர் டிரான்ஸ்பிளான்ட் பண்ணிக்கலாமா?
Again, very good question. Hair transplant or any surgery, when there is any additional morbidity, any disease, any morbidity, the risk increases. Okay, now if you have BP, nowadays even in younger age people have BP, they have diabetes and all. If it is controlled enough, that you are on a medication, you are taking care of it and it is controlled, then you can go for hair transplant. A little bit of extra attention we have to pay as a doctor, that your diabetes should not shoot up, your levels are maintained. Okay, so there is some amount of additional risk. If your BP is uncontrolled, if your diabetes is uncontrolled, definitely like any other surgery, we will not advise you to go for hair transplant. Okay, it is same as any other surgery. You can undergo, the maximum age in which we have done hair transplant was a gentleman of 72 years of age. Okay, he did not have any kind of comorbidities. Okay, so we could do hair transplant. He wanted to restore his look, we did hair transplant. But it is best to do when you don't have any disease, and if you have also, you have to be in the regular levels. Everything should be maintained, then we can do hair transplant easily.